everyone. Welcome to the Happy Flosser podcast. My name is Billy Luntz. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program and beyond. And when I mean beyond, I'm talking about today's topic, and that is the changes to the NBDHE, your national board exam. Sorry, you have to take so many exams that when I'm talking about them and thinking about them, sometimes I'm like, okay, wait a minute, which one am I on? So when we're talking about the national board exam, there is a candidate guide for you. So I want you to go to the Joint Commission, right? Type in NBDHE candidate guide online and go find it, download it, and read it. Don't just take my word for it. There are some updates to the guide and policy clarification changes from the 2025 to 2026. So if you went on to my podcast and you listened to the 2025 Preparing for the Board Exam Candidate Guide review, then this is not the most up-to-date information. This is why I'm recording a new episode about it today for you. So there are some policy changes, and anything can change at any time. The Joint Commission can make updates at any time that they want to. So make sure you check it before you go in for your exam. So there are some changes. Let me just talk about a couple of things. They've changed some of the language around fairness and confidentiality and ethical conduct for the exam, which I think is good. But here's some more important information for you, because I think that stuff is kind of expected. They want to keep the integrity of the exam intact, which to me is vitally important for our license to continue to be meaningful as far as knowledge-based and understanding. But the candidate guide for 2026 really gives us expanded details on things like the testlets and the item formats, like what to be expected, what's expected from you as a student. And to me, take a look in that guide and say, okay, what is the structure of the questions? They give you samples to look at so that you as a student can be best prepared for it. And I do know that the people in charge of writing the questions and looking over things, they painstakingly go through all of those case studies and questions to make sure that it is fair, that it is testing your knowledge and understanding, right? This is minimal competency, right, to work with the public. They have thoroughly gone through the dental charts to make sure that the radiographs are explicit, that they're clear, that the periodontal charts are clear, that the intraoral photos are not, mirrored backwards or anything like that. Those testlets and item formats have been rigorously evaluated for fairness and comprehension. So it's there to test your clinical reasoning. I will say, because we're not testing your memorization, we're testing your clinical reasoning. That is definitely the case at this point. So in 2025, the guide clearly stated that 43% of the exam is case-based, and that really holds true in the 2026 exam as well. Hold on, I'm going to have a small sip of my espresso. I love me a good espresso. It's actually a little mini, if you guys are on video, little mini cappuccino that my husband made for me because I was coming up to record a podcast. It's so good. All right. So that shift from memorization. So when I took the exam, yes, there were case-based questions, but not nearly as much, right? So for you to hear as a student that 43% of the exam is case-based questions, that lets you know that that clinical reasoning is impacted. So what does that even mean? So they're going to give you a scenario, right? There's 12 to 15 cases. So I want you to picture a person attached to each one of those cases. Maybe it's a 15-year-old child who has gingivitis and a high caries risk. They're going to ask you questions about home care and fluoride and how you're going to manage that patient's caries risk, and nutritional questions, right? If you have an 85-year-old woman who has osteoporosis and she needs an extraction, or maybe her denture is giving her trouble, there's going to be clinical reasoning and judgment that you have to show competency of when it comes to patient care management and what kind of risk this patient has and what vitamin deficiency should show up and what types of medication is she taking and what should you expect to see clinically when you look at this patient, and how are you going to manage and mitigate the risk involved with seeing those patients, Do you recognize where the risks are? Those are the types of things that you are going to have to show competency in. I tell students when I'm working with them, I want you to actually visualize a person because when you are in school, you see a certain number of patients, right? You have to see an adolescent and a child. You have to see an adult. You have to see a geriatric. There is a reason for that. It exposes you to all different types of patients with all different types of needs. Do not avoid the patient who's taking 6 medications when you're in school, because those 6 medications that you look up and then you actually see the clinical implications of patients taking those with higher risk, lean into that type of stuff because that's the type of stuff that the board exam is going to ask you questions on. I will also share that there's nothing wasted on the board exam. Every single bit of information that they provide you on every single case study is information that you are going to use in the follow-up questions that are asked about that case. So if they show you a patient who has gingivitis, you're going to have questions about gingivitis. If they show you a patient who's wearing an upper denture, there's going to be some questions about dental materials and oral pathology, or maybe a pharmacology question related to something going on the roof of the mouth. Think about that. What could be going on the roof of the mouth, right? So you can prepare. I know students get a little stressed out when they're like, how am I going to know? Think about what you could be presented with. You are going to have, if there's 12 to 15 cases, you're going to have a myriad of all the things. You're going to have somebody with diabetes. You're going to have somebody with elevated blood pressure. You're going to have somebody with perio. You're going to have somebody with an elevated caries risk. You're going to have somebody with a nutritional deficiency. These are all things to think about. If you were designing the exam and you were testing your friends on their knowledge, like you guys are getting together and studying for the exam, what types of things, what types of scenarios are you creating for each other? What types of conversations are you having while you're in your final semester of clinical rotations and you're preparing to see all these different types of patients? These are all the same types of things that are on the exam. So you don't even realize that you're studying while you're in school, while you're in that final semester, seeing all these different types of patients. So what I tell people to do when they're doing case study studying, yeah, that's case study preparation, I guess, is to picture a person, visualize a person in your mind. If you're reading a case study and it says the girl is 35 years old, the rest of the story is going to be different than if the first thing you read is that the patient is 85 years old. The risk level changes, the immunocompromisation changes, is that a word? Immunocompromisation? I don't know. All the different things change with your patient based on the age. And yet that's usually the first thing they tell you is how old the patient is. So don't just skip over that. Visualize that person in your head. Make somebody up in your head. Create a little AI case study person. Because sometimes students will miss the fact that the patient might be 24 versus 76. And those matter. Those little details matter. So when you are practicing case study questions, it's not memorization at all, but it's your clinical judgment. And you have been practicing your clinical judgment since the start of the program. So this is the stuff I want you to lean in on. Now, there's no change in the exam length or the structure, right, from 2025. So if you've talked to your senior buddy, it's still a 9-hour exam. There's still 2 sessions. There's 200 discipline-based questions in the first session, and there's 150 case-based questions in the second session. So that first session, you are going to look in your candidate guide. It tells you exactly the breakdown. It's pretty much everything you learned in all your didactic courses, okay, from A&P and chemistry and biochem through oral anatomy, pharmacology, oral and histology and embryology, all the things, right? Perio, radiology, dental materials, oral path, all the stuff. Then you have one little section all by itself in those 200 discipline-based questions that's strictly community-based, right? It's like, it gets 23 of its own questions, community does. So make sure you look through your biostatistics and you understand the mean, median, and mode and all that stuff. And really how to take your brain and go from one patient to a population. And if you can do that, you do really well on the community section. But then 150 questions, all based on cases. And that's leaning into what you learned in your clinical rotations, right? All the preparation for patient care, knowing the medications, knowing the side effects, knowing the risk level, knowing medical emergencies to avoid, things like that. Okay. Phew. And there is year-round testing availability when you go to Pearson View Center. So I know everybody just wants to schedule like at this perfect time in this perfect moment, but I will tell you, it's better to be as prepared as you can. And what I have seen with students is that their friends might be ready and they might not be ready. You want to make sure that you feel ready. It's not about being ready and knowing the material. It's about how you feel about being ready. Do you feel confident in your knowledge base? If you don't, take some time to do some studying and refresh. You'd be surprised when you do some recall how fast things come back to you. Okay. So it's one of those things, right? It doesn't have a structural overhaul in the 2026 guide, so it's very much the same. Okay. The biggest ongoing shift is to put more weight on those case-based questions. And that started last year. So I think as a student, this bodes well for you. Okay, this is the same. So when you think about stronger emphasis on the exam component explanations and reinforcing the importance of case-based reasoning, I think that helps with your strategy as a student, really. If you lose the most points on case-based practice questions, in the clinical setting, I want you to look at the learning management software and say, okay, where do I lose points in clinic? Where are my weak areas in clinic? These are the things you can lean in on to be the most prepared for the board exam as as a preparatory for yourself. And if you are not using the candidate guide as your primary source of preparation, I don't know what to tell you. I want you to make sure you have the candidate guide. It literally tells you everything that you need to know in preparation. When you're in school and we tell you everything that's on the exam as you're kind of going along, that that is for a reason. We want you to be prepared so that when you when you come into the exam, you are as prepared as you can be. So remember, right, that national board exam is it's not just testing what you know, it's testing how you think. And that is something that you've been doing the whole time you've been in dental hygiene school, from pre-clinic and in your study groups with one another. So I think you guys get a little freaked out because it's such a high stakes exam. But at the end of the day, if you take some time, build up your confidence, recall all of the stuff that maybe has been a little bit since you first studied it and learned it, and you really lean in on where your strategies can be for case-based questions, I think you'll do really well on that. So if you found this episode helpful, please share it with your friends and don't forget to follow the podcast so that you never miss an update. If I've said it once, I've said it 100 times. You've got this, and I'm cheering you guys on every step of the way. Have a great week, guys, and study hard.